You're listening to The Foundation of Wellness, a refreshing take on diet and lifestyle. Join me, Marisa Moon, as we tackle modern health with innovative and ancient principles. I'm a certified primal health coach and intermittent fasting instructor at marisamoon.com. Well, hey, it's me, Marisa. I'm your host today, and I'm so happy to have you. Thanks for joining me. Today on the Foundation of Wellness, I am interviewing, once again, Dr. Lenny Cohen. He is the founder and the medical director, the brains behind RevIVeDoc in Chicago, a med spa and custom IV infusion center. But he's also the founder of Lakeshore Hyperbaric Center in Chicago, the first of its kind. He's a board-certified neurologist and certified by the American Association of Psychiatry and Neurology with a focus on anti-aging as well as brain and body wellness. Now, having practiced neurology in Chicago since 2007, Dr. Cohen's applying his medical experience to enhance the lives of his clients in his first hyperbaric center, which you can learn more about at chicagohyperbaric.com. From hyperbaric therapy to IV vitamin therapy to custom brain wellness programs, every treatment in his centers is designed by Dr. Cohen himself with his extensive knowledge of medicine, physiology, biochemistry, and nutrition to keep your systems working in sync. And you can learn more from Dr. Cohen on our previous interview where he explained the benefits of IV vitamin therapy and concerns about increased oxidative stress in our bodies. And that interview is on episode number 57 of the Foundation of Wellness. Today, Dr. Cohen explains what hyperbaric oxygen treatments are and why he's so passionate about it, what the benefits are, and why oxygen is so important to heal and rejuvenate our bodies. And this is an especially important idea to consider for anyone with traumatic brain injury or concussions, children and adults with neurological disorders or autism, and persons with diabetic wounds or circulatory issues. It seems to be an incredible anti-aging strategy as well. It's also popular with athletes and high performers. So I hope you enjoy today's episode. Here we go. Welcome to the show, Dr. Cohen. It's really great to have you back.
Hey, Marisa, thank you so much for having me back.
You're welcome. You have some important information to share that many of us have never heard of before. Hyperbaric oxygen therapy or treatments. I'd love for you to tell us why you became so passionate about this and what it even is.
Well, let's talk about the one molecule that you cannot survive without. I'm talking about oxygen. We all breathe oxygen. We all have oxygen. We all need oxygen. There's no way around it. So the oxygen as a chemical was on Earth for hundreds of thousands of years, but as a chemical substrate was separated technically not a long time ago, just about 100 years or so. So we always were passionate about how can we use it for the human body? Is there anything that oxygen can do for therapeutic modalities? Mm-hmm. And hyperbaric therapy is not exactly a new therapy. I always ask my patients, have you ever been in hyperbaric chamber? And answer 9 out of 10 times is no. But here's the thing. Have you ever flown a plane? If the answer is yes, then you've been in hyperbaric chamber.
Wow.
If you think about this, the plane, as it goes up, the pressure outside of the plane is decreasing. So the plane has to be artificially pressurized and it becoming a hyperbaric chamber. We're doing the same thing, well, without a plane, obviously, and on a ground level. The chamber looks like a little submarine, but the idea is just goes based on a very simple physics law. If you're increasing the pressure, the more gas, in this case, oxygen, can dissolve in your body. So in 60s, they did some experiment. If we're going to take out all red blood cells, those cells are responsible for taking oxygen from point A and transferring it to point B. If we're going to take all of them out and we will put somebody in the chamber, increase the pressure to 3 of the normal levels, 3 ATA or absolute atmospheric pressure, that person will have enough oxygen dissolved in a blood without red blood cells that will be sustainable for life. There's actually a book that you can find on Amazon. I believe that it's called Life Without Blood.
Wow.
But information is out there. And what it does is just keep like surprising me. I started, like you asked me why I was interested in that. I started practicing medicine, so quite some time ago. And like everybody else, I always was truly believing that we can give somebody a pill and fix it. Over time, I understood that, well, pills cannot be always the answer, or they're not always the 100% answer. We need to have something else that can be used either in conjunction or as alternative therapy, or something as a part of the more comprehensive approach. You guys know very well that diet is a very important thing. So as much as I prescribe medications as a practicing physician every day, but I was always on the lookout, is there anything else we can introduce to human body to improve how it works or to fix some of the pathological processes? And that's how I came across the hyperbaric chamber. It's unfortunately started in my own family. My father got ill and was diagnosed with Alzheimer's dementia. That prompted my research about what other things can be done. By the time when I started to do that, it was a little bit too late for my dad. He was already in rather advanced stages and nothing would really help him. But it allowed me to do further research and provide the service for my other patients. And if you're just going to do a quick Google search for hyperbaric, actually forget about Google. So Google is for regular people. Let's say you're going to do something on a PubMed, which is Google for doctors. And if you're just going to look at a hyperbaric therapy and therapeutic options, you're going to get thousands of different articles from different parts of the world.
Great.
United States is not the only place where we're doing this. Actually, in other areas, it's probably been studied even more so. In United Kingdom, for example, till 80s, they were using hyperbaric therapy for patients with multiple sclerosis, and they still do. But it's probably medications work much better than hyperbaric therapy, but it can definitely be used in conjunction. So there's always, as a scientist, as a physician, I'm always asking myself a question. Number one, do no harm. And unfortunately, some of the medications that we currently use are rather dramatic in their side effects. You have to be very cautious. I do not want to discourage anybody not to take their drugs. The drugs were invented for the reason. But you also need to be very careful about the possible side effects and decide what the best is for you. We don't have a silver bullet or magic pill that can fix it all. So everybody is unique. I do not want to say that we have one algorithm and we just follow that blind. That would be just reckless.
Yes, that makes a lot of sense, and we appreciate that. I should tell something that's a little embarrassing for me to admit, but I think our listeners might be able to relate. I remember reading a book once about the brain, and I understood that the brain really needs good oxygen to function properly. And I turned to my husband, who's also a physician, and I was like, because I have ADHD, and I was like, I think like my brain's really like lacking oxygen because I don't take deep enough breaths and I just don't breathe deeply enough. And he was like, that's not how it works. Like you can't just breathe in more oxygen and get more oxygen to your cells. And that was really surprising for me. I don't have a medical background or any training on biology like that. And so I was like, wow. Then I began to learn like why treatments like yours are so cutting edge, even if they have been used for a long time. They're almost like a radical concept because so many of us don't understand like how lucky we are to have this, ability to introduce more oxygen into our cells. So is that where the pressure comes in, and what kind of roles does oxygen play in the body?
All right, so to answer your question, pressure is important, but oxygen is important as well. You cannot take a deeper breath to get more oxygen because the concentration of oxygen in the air, doesn't matter what, is 20%. The only difference is if the pressure is changing. For example, if you decided to climb the Mount Everest and you've never done it before, as you're going to be climbing up, the pressure is going to keep dropping. The concentration of oxygen is still going to be the same, but your body is not able to extract that oxygen because of the pressure. If you're going to go down on the bottom of the ocean, the pressure is going to be significantly higher. If you're able to get the same concentration of oxygen, the oxygen that would be absorbed by your body would be much higher. So this is something called Boyles Law. It's a physics law that says that absorption of any gas is directly proportional to the pressure of that gas. So the higher the pressure, the more of that gas would be absorbed in your body. And that is a very basic principle of hyperbaric therapy. As you have higher pressure, more oxygen that we use in hyperbaric medicine is being absorbed to your body to have therapeutic effect. Keep in mind that we also don't use air, we use 100% oxygen. So we start with a higher concentration of oxygen, doesn't matter what. And that is bringing a lot of different benefits to your body, anything from decreasing inflammation, which is rather interesting entity, as well as affecting what we call hyperoxygenation or hyperoxia of your body. So you have higher concentration of oxygen that can lead eventually to formation of free radicals that kill infectious diseases. Some people are concerned that if those free radicals can lead to some problems. And that was rather interesting study that demonstrated that initially, no. But if you do it for long enough time, yes, you can develop some side effects to that. And that's why it's a medical modality. And that's why I tell everybody that you need to use everything with a caution and in moderation.
That's so interesting. So this is a treatment that people see results with one session, or is this something that you need to do over and over?
It's not that simple. It really depends what you're asking. For example, it's FDA approved it only for 12 different conditions, which is rather limited. It's just like a very small slice of patients. But let's say one of the conditions is carbon monoxide poisoning. In most cases, there's really nothing that can help you with carbon monoxide poisoning, because what it does, carbon monoxide is binding to hemoglobin and pretty much displacing oxygen. By us pushing more oxygen in the system, we're able to battle that. If it's just acute intoxication with carbon monoxide without any secondary problems, one session would be perfectly fine. If you develop neurological symptoms, which can happen, I think I saw cases of Parkinson's disease due to carbon monoxide poisoning, then you'll need to have a number of different therapeutic sessions, anywhere from 10 to 20. Somebody who has anemia, like we have a patient who is, due to religious beliefs, does not want to be transfused, but she has significant loss of blood to the point that I was surprised to see her walking with numbers that low. After one session, she feels like she's a brand new person because she is getting that oxygen that she was not getting for a very long time. On another hand, if we're talking about people who develop delayed radiation injury, let's say we have a patient who had a cancer and that was treated with exposure to radiation, and that cured the cancer, which is good. But unfortunately, a lot of times patients are not being informed that about 15 to 20% cases, they will develop what's called delayed radiation injury that presents with anything from formation ulcer on the skin to formation ulcers in your body, inside your intestine, for example. And that is very difficult to treat. And those people require anywhere between 40, 60, 80 treatments. So it can be quite lengthy. For our patients who do something what we call off-label, meaning that it benefits, but FDA never really approved it because it's a whole different conversation. It really depends on the condition. We can go for as little as 5 to 10 sessions to as many as 20 to 40 and sometimes more. It's all individual, as we talked about this in the very beginning. There's really no one size fits all.
Okay. Yeah, I can understand that. Hearing you talk about it makes me wonder, if it's FDA approved for some treatments, does that mean those are covered by insurance?
Yes. So a few of those conditions are covered by insurance. For example, as I mentioned, non-healing diabetic wounds. Before somebody gonna have amputation of the leg, which frankly, truthfully does lead to disability, we did have very good results with those patients getting better and able to ambulate on their own without any assistive devices afterwards. Patients who had delayed radiation injury, patients who have acute hemorrhagic blood loss and cannot be transfused, So some of these conditions, very limited, but some of these conditions will be approved. I'd say the one probably the most known what hyperbaric therapy wasn't approved for in the first place is Bands or Caisson's disease. The Bands is a rather interesting term. It was initially noted that people who were building Washington Bridge in New York, because they had to go down about 100 feet from the sea level, over time, they start to walk kind of weird. They were bending. And only then doctors found out that as you go down and you breathe air, the nitrogen that is the biggest part of the air dissolves in your blood. But as you go back to the surface, that oxygen gets much bigger. And it really depends where it is in your body. If it is in your skin, you have something called cutaneous bands. It's not dangerous. It's like you will get better on your own. But if it ends up in your spine, for example, you can end up paraplegic or hemiplegic and unable to move. And I've seen cases like that too. So it's not common because we have a very rigorous process for divers, but still can happen, especially when people go overseas where diving injury is just mostly for tourists and nobody really watching over as closely as it's done in United States. But once again, everything can happen. And those patients are being treated with rather prolonged therapeutic sessions. A lot of our patients, they come for something called off-label. So they learn about that, they hope that it will help, and we try to help them. We do provide Medicare fee schedule for our patients, which still not cheap considering how many sessions do you need to do, but can you really put a price on, let's say, we had a horrible case of child with traumatic brain injury who pretty much was unable to do anything. And after 20 sessions, when I was thinking that nothing is really changing, his mother was able to identify social smile as well as a child who had no muscle tone whatsoever and now was able to scooch on the floor.
Wow.
And for me as a physician, it was not significant. And for her as a mother, it was like night and day. And sometimes we have absolutely unrealistic expectations. We had a patient who had a stroke, who could not move his arm. He did this therapy. It showed that in some studies that it can benefit patients after stroke. And after 10 sessions, the arm that he was not even able to lift, he was able to lift against the gravity. But from his point of view, it was not enough because he was trying to achieve the full utilization of his arm. Mm-hmm. So I'm always trying to be very careful about making promises for our patients. Mm-hmm. And everybody responds differently. It depends on what kind of pathology did you have, how young or how old you are. Mm-hmm. How often do you do this? Like everybody else, we have people who come and say, well, I just want to do it once and see how it goes. Well, like if you do any medical modality only once, let's say you went to physical therapy and you did it once, is it likely that it will help you? Probably not. So like my job in many cases is just to educate patients, to let them know why are we doing this and what they can potentially see. And
yes.
It's not an easy job, but that's what doctors used to do for time. We used to be educators besides being healers.
Yeah, you must see people coming to you at the end of their ropes, like they've tried everything else, and the very last thing they're willing to try is this, intensive therapy.
Unfortunately, correct. Most of the time, either somebody waits for a very long time due to many different reasons. They're hoping that it will get better. They do not have finances to do this. Or just simply distance-wise, again, like we have people coming from different states. Probably one of the furthest away patients that we had was from New Zealand.
Oh my gosh.
I'm saying the person came here not just for this. He came to be treated by some other physicians, but he had a concussion, and he was a young gentleman who actually was going to med school. And it was rather interesting, a very comprehensive approach between me and some other doctors who specialize in concussion. We were able to get him much better than what he was before. Yeah. And I'd say things like that make you feel good, make you feel like you're actually doing something.
Mm-hmm. Yeah, you can really notice the results, especially when their behavior changes or something they were not capable of doing before is now a possibility. I'm hearing you say that the common uses for hyperbaric treatment are neurological disorders and injuries like traumatic brain injuries, concussions,
Correct.
and cardiovascular events as well.
So funny you brought it up. There were a few studies actually done in Europe for patients who had heart problems, and they did a traditional approach with medication and maybe even stenting for the heart blood vessels. And they did one group of people who did traditional, normal Western medicine, and another group of patients who had traditional, normal Western medicine plus hyperbaric therapy. Those who had hyperbaric therapy, the outcomes were much better than those who did not. And frankly, it's very easy to explain. Hyperbaric medicine works very well for muscle. And as much as somebody wants to argue about how complicated the heart is, after all, it's very simple structure. It's a muscle. It's much more difficult to treat a brain than to treat a muscle. But also there were some studies that indicated that patients who have atherosclerotic, meaning accumulation of cholesterol on their blood vessels, with the treatment of hyperbaric therapy, that did decrease, which kind of most likely brings the point why we have this formation of atherosclerotic plaques. And one can argue it's not only cholesterol. Cholesterol is a building material that does that, but there's inflammation that starts the process. Mm-hmm. And hyperbaric therapy was shown to decrease inflammatory markers like interleukins, tumor necrosis factor, and some other ones. It's also demonstrated that after doing few of the sessions on a specific pressure, your stem cells being recruited from your bone marrow, and you start to have more stem cells in your blood.
Wow.
Exactly. I mean, it's a lot of things, which unfortunately it's not being used for. I'll give you another example. Something called femoral neck necrosis, which is a disease of the big bone in your body called femur, which is part of your leg. And what happened is that you don't have sufficient oxygenation of portion of that. And over time, it eventually dies out. Unfortunately, it takes time, and it would be 3 to 5 years. It would be very painful 3 to 5 years. Eventually, the treatment choice would be getting a hip replacement, which is costly. And to make things more complicated, it's a relatively common condition in females in 50 plus age. And 20% of patients who had that hip replacement will have the same problem on the opposite side. Mm-hmm. So there was a study about 10, 15 years ago, I don't remember when exactly, when they did hyperbaric medicine on those patients who just started to have it. So they did not require painkillers, or they were not candidates for surgery yet. 90% of these people had full resolution of their problems, and 100% of them never developed problems on the opposite side. Cost of that treatment was still cheaper than one hip transplant.
Oh, yeah.
That being said, unfortunately, medicine is not always going the way as we want it to go, and we still have hip replacement as a standard of care.
Mm-hmm. I do appreciate you sharing this entire therapy with our audience because, you know, I'm always wondering, like, is it too much? Is it too, like, over the top of a concept to bring to people when I'm considering topics? But I think something like this is important because our own physician, our trusted physicians may not be aware of it or be aware that it is, so therapeutic for whatever condition you're dealing with. And then on top of it, there's too many people who feel like surgery is the only option and they need to be aware that there might be other possibilities. And
Marissa, I'm sorry for interruption, but let me just tell you something. Back in medical school, I learned about hyperbaric medicine exactly the same amount as everybody else, and it was exactly 2 sentences in a textbook.
Oh, no.
That's it. Everything else that I learned was purely based on my own interests, reading studies, exploring different medical journals, being a part of hyperbaric organization. And this is how it works. Unfortunately, I would like to think that although I'm on the frontier, but it's kind of uphill battle. One of the other things that I'm a very big proponent, and we talked about this last time, that I like to, for my clients and for my patients, to be in, instead of following reactive therapy, just be more so into preventive therapy. So they not starting to do something when things already happen. And we're all concerned about developing Alzheimer's dementia. Well, there was an animal study that demonstrated that hyperbaric medicine is reducing the amyloid plaque in those animals that pretty much they artificially were giving this Alzheimer's dementia, like clinical genetic mutation that led to clinical presentation. If we will start therapy, I always encourage everybody, if we will start that hyperbaric therapy in your 50s when you start to have changes in your brain, because changes for Alzheimer's do not happen instantly. It takes about 15 to 20 years, meaning that puts you in about in your young 50s when you start to have those pathological changes in the brain, but your brain able to overcome it and able to provide sufficient memory as well as cognitive function till unfortunately you no longer can, and that happens in your 70s.
Yeah, and your quality of life really is determined by the quality of your cognitive function. I think a lot of us take it for granted, and then once it starts slipping, you can't, be independent like you used to be. You can't be creative like you used to be, and a lot of times it affects our mood. And depression is a very real thing as we get into old age. But I loved what you were talking about earlier about this stem cell kind of regeneration that's happening, because even stem cell treatments now, they're, soon it's going to become illegal of some kind. I don't know. There's just a lot that is inhibiting, us from using such treatments for regeneration in our bodies in America. But stem cells can be naturally, encouraged in fasting and hyperbaric treatment, it sounds like. And that's incredible for regenerating new tissue in an injury site or something that has, I don't know, how would you describe that hip condition that so many people deal with where they eventually need a replacement or a knee replacement? Is that something that those stem cells would help possibly prevent?
It's very hard to say, because the stem cells is, let's say you have a bunch of kids that you just let them roam Chicago streets for free. And some of them will end up in bad neighborhoods and some of them will end up in good neighborhoods. And so that's what kids will end up. It's like some of them will become your average child, some of them will end up being a criminal, and some of them will be a genius. The same thing with stem cells. We simply yet don't know how to program them to do what we want them to do. So in many cases, they're just being used based on what your body thinks is needed. If you have some other problems, they can form those cells. It's very, we're in such beginning stages of that we are far, far away from actually having a true stem cell therapy where we can say, okay, here's a stem cell, we're gonna program that to do X, Y, and Z, and then we're gonna inject it in that area. We are not there yet.
So when you're talking about what is going on when hyperbaric therapy is actually helping, what is it? Is it the oxygen is helping to renew our cells, or is it helping us grow new cells? What is going on there?
It's many different things. So it does help specific cells to be grown, specifically collagen cells. That's why it was approved for patients with non-healing diabetic ones. It's stimulating growth of collagen cells as well as some of the bone cells. So yes, it can affect some of the cells directly. In some other cases, what it does, it works indirectly. It's affecting intracellular mechanism and signaling that allows cells to do what they're supposed to be doing. We don't know, that's a whole big controversy about hyperbaric medicine, that sometimes we simply don't know how to explain it. We want to explain it. For a very long time, we had a very simple explanation. Well, a lot of oxygen is very good for you, so this is it. But now we know that it works somehow. We just don't know exactly how does it work. We have theories, for example, patients who have concussions, patients who have stroke, patients who have fibromyalgia. There were studies that demonstrated for each of those conditions that hyperbaric therapy is beneficial. An explanation for that is that it's improving neuroplasticity, or connection of neuronal cells in your brain.
Wow.
It's a theory because you cannot prove it or disprove it. But there are definitely some studies out of Israel for fibromyalgia as well as for stroke that demonstrated significant improvement in these patients. Even the very first studies that were done in the United States for our soldiers, for veterans, in the 80s demonstrated improvement in the mood and decrease of depression. Unfortunately, the Department of Defense decided that the study was not vigorous enough for them to approve it. But there are a lot of data that shows that hyperbaric medicine can do wonders for the brain as well as for the rest of the body. We still have a hard time explaining why does it do it, and that's why it brings so many skeptics who are like, well, if you cannot explain it, that means you don't know how it works. But I can also tell you there are plenty of medications that we have. If you're going to look at how it works, it says exact mechanism of action is unknown. Sometimes we just use things because they work. That's all.
Wow.
I also want to advise some of your listeners that there are different types of hyperbaric chambers.
Okay.
What we utilize is a medical grade chamber, which is hard chamber, plexiglass tube. I can pretty much drop it 100 feet down to Lake Michigan and nothing will happen to it. Not that I'm planning on doing something silly like this, but it can sustain that. And another type is a soft chamber. Problems with the soft chambers are never really meant to be treating somebody in the long term. They become more popular after one of the athlete NFL player demonstrated that he sleeps in that, which I'm not a big fan of doing anything for a prolonged period of time. Number two, in many cases, if you pressurize it with air, it's like you're extracting such a small percentage of oxygen, like you're literally talking about decimal points. If you think that it's working for you, trust me, physics is not on your side. It's just doesn't work because it cannot work. Those soft chambers meant only for very small pressure increase, and they meant to be transferring scuba divers who got injured from one point to another one to actual center. So that's why if you have to do something, do it right. Appropriate centers that carry appropriate equipment and that can help you.
Okay, so it makes a difference what type of hyperbaric chamber it is, and you recommend the hard one, not the soft chamber.
Correct.
Okay, and I'm interested to know what gave you the courage to actually open a dedicated center if this is such an ambiguous treatment, or I don't know. Can you even define who your ideal patient is that really this is calling towards?
Oh, absolutely. Well, to answer first question, probably being silly and naive. That's what prompted me to do this. I did not realize how expensive it is to run something like this. And it's definitely became like another child in my family.
Okay.
I'm spending all weekends in a center. If my staff cannot provide services, I'll be doing it myself. Mm-hmm. And another reason was curiosity, because there are a lot of data that truly showed some benefits. Like right now, we have a little child in a tube who has autistic spectrum disorder. He had only 10 sessions. And every time I'm asking his parents, how's he doing? And it's okay, it's okay. Another day, they were like, well, it was the first time when he was able to have sustained attention to finish something that he was never, ever able to do. Who is my perfect patient or client? Somebody who is somewhat educated about their condition and somebody who's willing to take control of treatment in their hands, that they will be understanding that we unfortunately live in a time when everything is either covered by insurance or not covered by insurance. Mm-hmm. And that's how a lot of patients perceive their medical care. If it's not covered by insurance, well, maybe I don't need it. Or let me talk to my physician and see what they think about this. Well, the problem is that they probably don't know much about this in the first place. But the patients who, like once again, concussion, traumatic brain injury, autistic spectrum disorder, patient with Lyme disease.
Oh, wow.
We had good results with all of these patients. It's just a matter, like with anything else, it's just a matter of finding the right therapy for the right patient.
Okay.
And before somebody's going to be having any sort of therapy, we will talk to them to be sure that what we're doing is right for them. Like I am not a good salesman. And frankly, there are probably more cases when I turned people down and told them that we're not going to do something for them if I thought that they would not be a good candidate.
That's good to know. You sound like my husband.
Well, I like to think that doctors, after all, designed to do something to help patients and not just to blindly be a snake oil salespeople.
Right, of course. Well, you've given us a lot to think about, and I appreciate you bringing up the ideal conditions that hyperbaric treatment is really appropriate for, or more promising for. Is there somewhere that our listeners can find testimonials or stories about your previous patients?
Your listeners can go to learn more about that. They can go to our website, www.chicagohyperbaric.com.
Okay.
And they can learn more about this, and hopefully in the next few weeks or months, depending on how much time do I have to dedicate to writing up, we'll try to post some of the success stories. And trust me, we had plenty of those.
Great. And does someone have to come in person to your center to have a consultation, or do you do virtual consultations or anything like that?
So if they try to use insurance, yes, they need to come to the office because we need to document and submit it to the insurance company.
Okay.
If somebody just want to talk about their condition, they can contact us, and I would be more than happy to give them a call and talk to them about what we can do for them. Okay.
That sounds great. Well, again, your website is chicagohyperbaric.com, and you also run the RevIVeDoc, so therevivedoc.com. Both Chicago.
Yes, and they're right next to each other.
Oh, perfect. For your sake too. My gosh. I know you're very busy. Well, if there's anything else you'd like to add, we're about to wrap up. I'm excited about this and hope we can help you get the word out.
Well, thank you so much for inviting me again. I certainly hope that your listeners will learn something from your podcast, and they just need to be curious about their own health. Mm-hmm. Because as we are developing new technology, something is applicable to some, something isn't. After all, it's their choice what they're going to do and how they're going to do it. After all, I think that my, as well as my co-workers' job is to educate consumer about what's the best option for them, how they need to be treated.
Yes, and I find you and your team very trustworthy, so I recommend you highly, and I can't wait for people to reach out and meet your team because you're doing something special. So thank you.
Thank you so much, Marissa.
I love the fusion you have going on of mainstream medicine with a holistic approach, and that's needed. Well, I hope you have a wonderful day. Thanks for sharing your knowledge with us.
Thank you, Marissa. You have a lovely day.
Thank you for listening, and this episode is brought to you by our affiliate, Dry Farm Wines. Enjoy old world natural wines in this unique wine club called Dry Farm Wines. It's where they test their wines to be sure that they're sugar-free and sulfite-free. They're really involved in the process too, visiting these international vineyards who are doing things the correct way, if you ask me. I mean, these wines must be grown without irrigation and without chemical fungicides or pesticides, nothing beyond organic I'm talking about. And just using natural rainfall and wild yeast, they are able to make wines the old-fashioned way. And the result is an incredible collection of wines that is always changing. And you can try Dry Farm Wines yourself with a case of 6, red or white or mixed, and you can get your 7th bottle for only a penny. It's basically free, right? But you have to use our link. It's dryfarmwines.com/FOW podcast. Of course, that stands for Foundation of Wellness. Again, that's dryfarmwines.com/FOW podcast. I'm personally so in love with Dry Farm Wines. I have been for years, and I can't wait to hear what you think of them too. Thanks for being here with me today, and your support means the world to me. I really do put so much time and consideration into this podcast so that I can bring it to you every week whenever possible, and I just love sharing the information with you. So please share our show with others. And I invite you to reach out to me if you're considering working with a health coach to help you overcome health challenges and reach your wellness goals. You can go to marisamoon.com/consultation and just schedule your free strategy call with me so that we can decide if health coaching is the right thing for you and I to do together. Thanks so much for listening. Talk to you soon.